social media needs glamour. So in that case, people coming with Samantha, Nayanthara, Trisha eyebrows and saying that I want to look like this, my eyebrows has to be transformed like this. Banking professionals, IT professionals, doctors, dermatologists, plastic surgeons, dentists. So I see many people like there is a wide open in this industry that when you are involving needles, when you are involving something you are injecting inside the body, you definitely need to follow certain medical protocols.
Hi, welcome to Rashmi Conversations. The business of beauty is one of the fastest growing and evergreen businesses across the globe, not just India. And today I have with me a guest who does something very unique, something actually which is really catching on. It's a trend in India, and she's going to show us the other side of beauty, the impact it has on the human mind, and what it means, what it is, the business of beauty, how it looks like today. So I have with me today Dr. Subhashini Balaraman, who is the clinical director at Mayon Groups, IAASN Academy, MAPI Academy, and Global PMU Summit. Hi, Subhashini, welcome to the show. I'm so excited that you're here. I met you a month back, and I was immediately struck by how perfect you look. And then when I came to know that you are actually a person who gives this look to people, men and women who meet you, I really wanted to know more about what you do. So tell our guests about a little bit about yourself.
I come from healthcare background. So my specialization goes into dentistry, nutrition, cosmeceutical formulation and permanent makeup.
Okay, wow. And isn't nutrition and dentistry, and then you're saying permanent makeup? It's like so diverse, isn't it?
All come to aesthetics and well-being. So that's where it took me interest in bringing in all the departments together.
And the PMU as a art, like which is permanent makeup. Um, how do you feel it has grown in the last 10 years or 20 years in India?
Tremendously.
And when did you start? A little bit about your journey.
A decade. So it's almost 10 years now. When I started my PMU practice, I actually started my PMU practice in Chennai, then in Sri Lanka. I mean, when I started doing permanent makeup, people had the confusion why a doctor started doing tattooing procedures. So even my colleagues and my mentors, everyone started questioning me about the decision which I made. There was one interesting story which turned me from dentistry to PMU, which that is where the turning point happened. I had a patient where I was doing eyebrows microblading. So I had a new patient who walked into the center, and that's a male, obviously. He came and he had very less hair in the eyebrows. I had a consultation and we started discussing about his expectations. I was the only artist who was doing hyper realistic brows at that time. So we were discussing having a consultation. Once after the mapping, I started the procedure. Once I completed the procedure, I saw, once I gave him the mirror, I started seeing the tears of joy in his face. That is when I realized PMU is not just about the beauty. It's about like transforming and giving the self-esteem back to the person. And
And it's a very personal thing which cannot be expressed like.
and it is really personal. It's more than just the cosmetic procedure, where he started seeing his part of him came back again.
You covered so many aspects in what you just told me. I want to first touch upon this aspect, where you said that this is not tattooing. Because when I actually met you for the first time and went through your page, because today on social media there's so much exposure, so many reels about, people putting black dye on their eyebrows and then transforming and tattooing and all. I actually thought it was tattooing. So I first wanted you to tell me what is the difference between tattooing and PMU, and also explain to me, there's a general fear about, doing something on your skin because there's a fear of cancer. I would really like for you to touch upon these points.
Okay. No, PMU is definitely not the traditional tattooing, but it is a cosmetic tattooing. There are a lot of difference between the depth of penetration between the traditional tattooing and the PMU, and the material what we use, the machine speed what we use, the type of machine what we use, everything is completely different. So that is where the differentiation starts. Traditional tattooing, once done, it will stay for lifetime, and the depth of penetration is also different. But the cosmetic tattooing or the PMU procedures will fade away in certain duration. That is where you can easily identify. If someone says that the PMU is lasting more than 10-15 years, then that's not a PMU, it's a tattoo.
And about, the safety, I see so many people in just small parlors doing something with the face and the eyebrows. And is it safe? How does the body react to it?
Yeah, this is when the medical safety protocols come in a play. It is very important to undergo, it is very important to maintain the safety protocols when performed on face or in the body, because it is not just the cosmetic procedure. When you are involving needles, when you are involving something you are injecting inside the body, you definitely need to follow certain medical protocols, safeties. You should understand the skin healing, wound healing mechanism. You have to know how to manage the complications or how to avoid the complications. These are where proper training plays a vital role when it's come to PMU procedures.
So, one of the aspects that you mentioned was, your mentors and well wishers were so shocked that you entered this artistry kind of an aspect, being a doctor yourself. But today, I actually noticed so many doctors who are tending towards the artistic side of beauty, even dermatologists. Why this shift? And is it better for someone to actually opt for a doctor for doing a makeover?
For the past so many years, I've been training doctors, dermatologists, plastic surgeons in this particular PMU industry, and also in paramedical tattooing, that is medical micropigmentation. I have a lot of doctors who show much interest in this segment, because when it is performed properly, when it is performed under a medical protocols, there is very less chance in the complication, and you are going to definitely see the changes, and it is going to give you a very good reputation. Then why not? So that's the reason you see a lot of other industry artists or other industry professionals are coming inside this PMU particularly.
The medical side of it, can you touch upon that a little bit? You said that even paramedical tattooing is happening. So what is actually covered in it? Because to me it was just looking beautiful, but there seems to be another side to it.
Yeah, of course, yes. This is where it is very important for everyone to understand that PMU is not just only about the enhancement procedure, but also it works on corrective procedures. For example, it's not just about eyebrows, eyeliners, lips, or freckles, beauty spots. There is another segment in PMU called paramedical tattooing or medical micropigmentation. There we focus on doing camouflage procedures, vitiligo camouflage, stretch mark camouflage, scar camouflages, areola reconstruction after breast surgeries. So there are a lot of segments in medical micropigmentation, which will be really helpful once after any surgeries or once after any camouflages. So that is definitely going to help many patients.
Is there an awareness of this in India?
Very less, actually.
Because this is the first time I'm hearing that even such a thing is there.
We have been doing paramedical tattooing for quite long time. That's because of social media. Many people don't usually promote things in social media when it's come to paramedical tattooing than beauty procedures, because social media needs glamour. So in that case, the paramedical tattooing were not much promoted in social media, and that's the reason the awareness is quite less.
Doctor, when I did a little bit of research on this topic before meeting you, I observed that this is over $1 billion industry worldwide and growing rapidly. Um, are you seeing overall adoption in this industry, and how can a normal person who's not from the medical profession enter this? Is this as a career option a viable option?
It is, yes, because we have been training many professional individuals in this industry for quite long time now. People initially get into the industry out of passion, second because of the trend. Once after they are doing this as a part-time, once after they start seeing the profit which they earn from this industry, now they are turning that into a full-time profession. So it's obviously a very good growing industry right now.
And among your patients or your students itself, I'm sorry, can you give me examples of what kind of people today are entering into this industry?
There are a lot of professionals who are coming into the industry, banking professionals, IT professionals, doctors, dermatologists, plastic surgeons, dentists. So I see many people, like there is a wide open in this industry. That's the reason you can see everybody is doing PMU right now.
And but you spoke about having in-depth understanding of skin and healing. If so many artists are coming in, how should a person choose the right artist? Should they be a doctor themselves, uh, or should they be at least affiliated to a doctor?
You don't need to have a medical degree to enter into PMU right now in India, but you need to understand the subject. You need to understand the subject properly. Taking a right masterclass, understanding the healing process, understanding the right, having the right knowledge about the subject is very important. So taking a right training for good amount of time and practice is mandatory, because people think once after doing 3 days 4 days masterclass I can start my trainings, I can train people. That is not possible. You need to understand, you need to observe how the healing process is happening person to person, working on with the different geographic areas, working on with the different genders, age group. You need to understand how the response of the procedure towards the body, how the body is responding towards the procedure. These are things you need to document. That's what I usually insist my students to do. Whenever you are doing any procedures, initial 10 cases, start recording, documenting everything. So once you understand how, the pigments or the machine, the cartridge, the technique, whichever you are using, you need to document them, analyze them, how it is responding. Based on that, you can upgrade yourself. So this industry is all about upgradation. That is how you can come up with more innovative ideas, innovative techniques.
How regulated is this industry globally and in India?
In India, there is no any specific regulations as such right now. But in European countries, you can see REACH compliance, EU. There are a lot of other, even in South Korea, medical professionals are allowed to perform PMU. But for patients who are taking, or people who are planning to do PMU, certain questions are very important for them to ask while taking these PMU procedures or paramedical tattooing. Whether the artist is doing patch test, medical history is properly evaluated, sterile disposable cartridges are used, aftercare guidelines are given, and contraindication screenings are done, what type of pigments they are using. These are very much important. Along with that, a person should read informed consent and sign the consent before starting the procedure. These are very much important before going to the PMU procedure, because these are not just the cosmetic procedures but something related to medical industry.
Doctor, I'm one of your customers or patients, you can say, and this is the first time I ever explored doing anything on my body. Honestly, what I really liked was, that I always loved Nayanthara's eyebrows, but the point is, I'm not Nayantara. I don't look like her. So even when I was coming to you to meet you at the clinic, I was thinking that I should look like her. But what I loved what you did was, you measured my face and you told me that, hey, this is what is going to work for you. If you can touch upon, was that only me or do people actually ask that question? Wanting to look like a celebrity?
This is a pretty common question which we get in the center. People comes with a reference picture, not just the celebrities. They comes with the reference pictures. They usually come up with lot of, first coming to the point of celebrities. Yes, we get lot of people coming with Samantha, Nayanthara, Trisha eyebrows and saying that I want to look like this. My eyebrows has to be transformed like this. I want to make it look perfect, symmetrical as such. But PMU is not the copy-paste procedure. So we will be doing PMU based on the facial anatomy, morphology. We will be measuring the face, and based on the eye shape distance, we will be giving the eyebrow shape. So that is how we will be performing. So it's not something like copy paste from one face to other face. That is not how PMU works.
You spoke earlier about a lot of people entering from the banking and the IT sectors. Can you give me, if there are aspiring people or people thinking of switching their careers today, watching this show, can you give me a ballpark and understanding of what kind of earnings can they expect? Because this is just a very nascent industry and it's about to boom and explode, right, in India.
Yeah, that's what I mentioned. Like my students initially started that as a part-time job just to earn a part-time money. Now they are turning this into a full-time career. That's how the industry is profitable. So people starting from 1 to 3 lakhs per month earning in metropolitan cities. And coming to metropolitan city, the surprising factor is there are a lot of booming about PMU because of the social media and even tier 2, tier 3 cities as well.
So you have students from tier 2, tier 3 cities, and is there a demand? Are they able to go back and establish profitable businesses for themselves?
Yeah, of course, yes. I see a lot of students who are doing very good job in those cities as well because they are the one who are starting very new. One difficult part there is they need to do consultation along with educating about the procedure as well. That is that is definitely, and the one who are going to start this first, so with the very less competitions.
But with this, the penetration of social media across India, I don't think education is going to be a problem for very long. Uh, and coming to the aspect of you being an entrepreneur, you've built this entire empire of being an artist and being a teacher on a global platform, not just in India, on a global platform. If anybody were to enter this field as an artist who wants to build something like you, an empire around beauty, what would you say that the kind of mistakes they should avoid?
Improper education about PMU. Never ever fall for just social media education. You need a proper mentorship before entering into new industry. So it's something like you are shifting your career with just 2 or 3 days program. That is not enough. Definitely you need an in-depth knowledge about the subject before entering into it. So it's very much mandatory for anyone and everyone to start with a good mentorship and the continuous upgradation of their education. This is very much mandatory. One is to keep them updated, and two is to give them good results and repetitions.
So investing in courses is what is going to give you retention marketing, repeat customers.
Yes.
And what are the other aspects that people overlook without even thinking? I remember once you spoke about legal being a very core component of your startup.
These are procedures involved in using needles. So, obviously, the legal compliance is very much important. And to educate the patients, they need to understand how the procedure works because social media will look definitely glamorous and posting immediate after pictures. That is not how it is going to heal. The makeup look or anything, it is not going to be the long term results. If that's a longest misconception people have about PMU is permanent makeup. Since the name says permanent makeup, it is not permanent, it is not lifetime. That means long lasting. So the right word to describe PMU is semi permanent makeup. It's not permanent at all. Person should understand how the procedure works, immediate afters, healed results. They should understand. Even this is very important before starting the procedure. It is a responsibility for an artist to explain their client to make them understand how the results are going to be after 15 or 20 days, after 80 days, after 90 days, after 3 years or 4 years, how the results are going to be. Why the eyebrows are turning black, why the eyebrows are turning blue, green. These are things a person should explain their client before starting the procedure. Because people see only the social media, see the before and afters, and they are entering into the clinic and taking these procedures. But these are the things we will be mentioning in the informed consent, where we will be mentioning about the complications of the procedure as well. So before taking the procedure, they have to understand everything, then only they can start the procedure.
And which aspects of this business do most people actually bleed cash on? If you were to give advice, mentorship advice, that idella panna kudadu, you shouldn't do these things, you shouldn't invest in these things. before you learn to walk before you run kind of a thing. What would that be? How do artists actually lose money?
When people are entering into PMU or any sort of aesthetic business, people started focusing on interiors, luxurious setup, machineries, and a lot of material investments. But before all these artistic works, where you need proper education first, understanding different techniques first. If I talk about eyebrows, there are at least 5 to 6 different types of eyebrows which we perform. So people should invest in their education first, then in their studios.
In general, if you see social media and refer to PMU or search about PMU, it's all women led conversations, right? But I remember you mentioning to me when we spoke the last time that there are a lot of men who are coming to this field, and there are a lot of men seeking this kind of treatment from you as a doctor. Can you tell me a little bit about the industry, how men are actually a very huge part of the customer base that you have as a client, student, and why they don't talk so much, whereas women talk so much about it on social media?
No, actually, this industry is definitely not gender specific, because in the international market, SMP is literally ruled by male artists. I see a lot of male artists who are doing SMP, which is scalp micropigmentation, which we do for hair loss. So that segment is completely dominated by male.
So you mean you're planting, like doing hair weaving?
No, it's like implanting pigments in the scalp. So it's like a dotted pigment deposition which will mimic the short hair.
Oh, just looks that your head is full of hair.
Exactly. So people who want to maintain the complete shaved look, SMP is the best option for any sort of hair loss. I mean that technique is now very much applied in the female pattern hair loss as well. So for female who have lot of hair loss and widening of their partition, where we do micropigmentation to give the density back. So that is not hair implantation, it's just a pigment implantation to give the illusion of volume.
And I noticed, I remember you spoke about how a lot of men opt for lip lightening.
Yes. When I'm doing in India, I get a lot of male dark lip neutralization than female. Many men, because female, I see a lot of female who have dark lips, they wear lipsticks, something to cover the dark lips. I see there is no male wear lipsticks in India, so they cannot cover the dark lips. But some will get humiliated by asking whether you smoke, what happened to your lips, and getting mocked because of their lip color. In that case, the main major expectations of male who are coming to dark lip neutralization with me, they say one statement: doctor, it should not look like I've done nothing. I mean, I did something on my lips. I don't want the lipstick effect. I saw a lot of social media videos showing before and afters, which looks extremely like a lipstick. I want to keep it natural. So this is the major expectations what they have. That is when I coined a segment called Melt plus Tonex. This protocol works mainly on dark lip neutralization. That works choosing the gum color of the person, that is mucosal color of the person. So that is bringing the undertone of the color from within. So that exactly looked like their natural lips without the melanin. So that is something which I'm doing for male dark lip neutralization.
And I mean, usually men are not very conversant. Like for me, if I want to buy a kajal or something, I'll speak to 10 girls about it. But there's a general taboo for, I guess, for men to discuss this with each other. So it's great that they are seeking help and because men are also conscious about themselves, about the way they look. It's not just a female thing.
Okay, this is pretty interesting because out of my experience seeing patients for these many years, one thing which I noticed among these two crowd, female, they'll come to the center, they take decision on the table, like while having the consultation. Once after I give the confidence, once after they feel, okay, this doctor can perform whichever my expectations are. So there where they take the decision. But men, they do lot of research. They go through everything, they sit, they decide, they talk within themselves for at least few months. Then with the proper decision they come, they have 2-3 minutes of consultation, they go with the procedure.
Oh, Then, okay, maybe I'm just, my bias is completely social media driven. It could be.
This point I'm saying from my experience with the patients.
Tell me a little bit about this academy that you run, and because you have a global exposure as an entrepreneur, what do you see, operating in this business across the globe versus India?
PMU in other countries are at least 5 to 10 years ahead of India actually. So they are doing, for example, conferences. There are a lot of countries, more than like 100 countries are doing conferences already in the market for very long time. But surprisingly, I was the one who conducted the first ever PMU conference in India in 2024.
Amazing. So when you're talking about 10 years ahead of India, you say that even the materials you are able to buy in India is not to the global standards?
The major material what we will be using in the PMU is pigments. So those pigments, the international pigments are already available in India. The one thing which Indian market is lagging is the education
Okay.
and the update regarding PMU. People now know about microblading, that's because of the social media. But there is another technique which is quite popular in other countries are machine hair strokes. But people are not talking about it. I see very few artists who perform machine hair strokes in the entire country. So that is where we are lagging, the update.
As an entrepreneur, doctor, tell me a little bit about finding your footing. Coming from the medical background, from the wellness industry, um, to then getting into the nitty gritties of running a business could not have been an easy journey, right? It would have been a lot challenging for you to learn everything step by step and build everything yourself. Share a little bit about your journey so that maybe a lot of women who will be watching you will be inspired to start on their own.
I come from a medical background family, so definitely not a business background. So it was very difficult for me. See, many doctors have this struggle. Doctors have passion, they raise fund, they start clinic, and they expand or maybe hospital. But the place where a doctor lack is the business management. So when a person is learning about business management, that is very important to survive in the current industry as
Yeah,
well, current
definitely.
market. So you need to know how to run a business, how to manage the losses, how to manage the financial system of the company. So these are things very much important for any entrepreneur to run a business, particularly for doctors.
How did you crack the code, doctor? I mean, considering that you come from a medical family of medical professionals, I don't think you would have had anybody to talk about, right? Because all of them would have been on the same boat as you. What did you do? How did you learn?
Learning through the journey. So definitely I had a lot of ups and downs. So I definitely got them through the experience.
When I came to your clinic, your clinic is like a well-oiled machine, which means that you've really invested a lot of time in training your staff. Can you talk about people management? Why do you value it so much?
Being an artist is a single man show, but running a business is a teamwork. So it is very much important for a person to build a proper team to run a business successfully and to have a good reputation.
I went through social media, and I think about a year or 2 years back, couple of years back, you had really, you were quite different. You were quite, I would say, on the heavier side. And I know you're a boxer. I want to know how you put, one of the biggest problems that people have is that, oh, how can I invest time on my health? I don't have that time. I'm an entrepreneur. 24/7 is not enough. But how did you do that?
I'm not a professional boxer. I was into boxing training that helped me a lot in losing weight. My focus was not on the weight reduction before, it gradually happened. I realized that my health is in hit when I started having a knee pain while climbing 2 stairs up. So that is when I started focusing more on my health first.
How has this transformation impacted you as an entrepreneur?
You will feel really fresh all the time. I started my day by like 4 a.m. in the morning. It's almost 9 p.m. But still, I have that energy. That's because of the food habit and lifestyle which I changed, and that made a huge difference.
So many people miss this. People are pursuing a career, pursuing money. It's important. All of it is important. I mean, for me also. But dropping the ball on your health, ultimately, the building of success you're building is on that small platform of your health that you're having, right? If that platform crumbles, there's no use of that building.
So it's very important for me to be me when I'm giving a consultation. So they're not just coming for a beauty treatment, they're coming with the hope. So I definitely need to observe and give the energy back. So I should be really healthy, not just physically, mentally as well. Because it's not just impacts me, but also my patients when they are having a conversation with me. So that is definitely going to give an impact in the consultation.
So interesting, doctor. I mean, it was so good. Such a insight on this industry, which is, to me, it was always on the periphery. That okay, this is entertainment. This is just beauties. For me, eyebrows or the way you look was just like putting nail polish. But there's so much of nuances behind this. Um, Before we end, I wanted to share some of the stories that you have encountered, your success stories with respect to your students and your patients and yourself, your personal achievements that will stay with you throughout your life.
One thing which always stays in my mind is about the Guinness, which I have done in 2021. That was a marathon record. Marathon record is doing a record for 24 hours continuously without any break. So I was performing eyebrows microblading on a stretch for 24 hours. The previous record was 30 eyebrows in 24 hours. I broke the record by doing 168 eyebrows in 24 hours.
Oh my God, that would have taken a physical toll on you. I mean, even one procedure I saw, you had to just sit in one place and not move.
Of course, yes. That record was completely organized by me and my husband. So it's not just that 24 hours. Pre and post event was also a big task. Arranging everything, arranging that many patients, and doing all the befores and afters about the event. Because Guinness, there are a lot of regulations before attempting any record. So we were doing all the documentation works as well. So we didn't sleep for 52 hours in stretch.
Oh my God.
The biggest task for me was sitting there in the same chair for 24 hours continuously. So that was my biggest task. Doing eyebrows microblading was my passion. Like I love doing it. But sitting on the chair without moving was very difficult for me. So yes, it really tested my patience and my endurance.
And any stories you want to share about your patients, about transforming their lives and your students?
We have done a lot of scar camouflage procedures for acid attack victims.
Oh,
So that one gave me that was very close to my heart, because doing a scar camouflage procedures on face and body was really transformative. So I had a patient who had acid attack on her face. So she came to me for scar camouflage. She was so hesitated about the procedure because she don't know whether that will work on the face or not. It was a hypopigmented segment. I covered that area. The moment I saw the joy in her eyes, it was like, that is when I realized like why God led me to enter into this industry. So it made me really happy about choosing this industry. Here I'm saying this because I really want to create awareness among people who are planning to do scar camouflage on their face and body. It is definitely possible. So I want anyone who are looking into this podcast, because scar camouflage for people who have acid attacks or any accidental scars, we are doing that under our trust for free of cost. So I really want to share this in this podcast. So people who want to share this, they can share, and somebody will definitely get it. So
I hope many people are watching this, and I hope the message reaches the people who really need it. I'll share your page and your email and your coordinates in the description. I really hope people reach out to you.
for me, responsible artistry is my core system. It's very important for a center to perform and deliver the right technique and the right treatment for the patients. So they can contact us directly through Instagram or our academy. If the vision and professionalism aligns, we always open to discuss meaningful collaborations.
This is really fabulous work because I cannot imagine your life just feeling like it ends in a moment after something so drastic happening, and giving the hope back to such people is marvelous work. I hats off to you.
I have a very interesting story to share. There was a patient who have a vitiligo camouflage. She came to us 3 months back. She went to a different artist and she got her camouflage done, and it turned into blue color.
Oh my
The
God.
entire body. We have posted that in social media as well. So it completely got turned into blue in her hand, body, and also in the entire lips.
Oh my God.
When she came to us, the lips was entirely blue in color. She was so much into tears, and she was literally upset about the look. She even said that she had suicidal thoughts many times. This shows how irresponsible few artists are, their works giving the impact on few people. So we started doing a color correction. Then now we are doing camouflage for her. She's very happy. Every time she meets me, she say, whenever she comes to meet me, she prepares something like a food, and she brings with a joy in her face, and she says, "Doctor, I made this for you today. I made that for you today." Some people share their love and happiness through different actions, through gifts or through food, through cooking. So that is how she was really happy, and she shared so many things about the procedure. Like so last week when she came for the touch up, she said she was very much happy, and she was smiling, and she said, "Doctor, you know one thing, I attended my relative's wedding last week, and they said your lips doesn't look like you have vitiligo."
Wow. That's something, no? I mean,
Yes.
I have
It's
met
just a,
people with vitiligo and I see how they shy away.
it's just a simple statement for many, but you know how emotional it was for me when she said that it was looking normal. See, having a vitiligo is not abnormal, but some people feel less confident when they are seeing in the mirror, and many are getting mocked or separated from the common people because of such conditions. And this is definitely curable, and this can be corrected. Vitiligo camouflage is one such procedure which can give a long run result than any other procedures. So that's definitely people should have the awareness about.
For us, like for many people, beauty is skin deep, but actually it's not. It's when you look at yourself in the mirror, you actually see an image of what you believe you are. And I think PMU is something that can give that to many people. I'm really blown away that from cosmetics to life reaffirming aspects of the way you look can be done through PMU, which is just an art form. Um, and thank you for such in-depth knowledge and sharing your stories. I hope you enjoyed this conversation.
Of course, I really enjoyed this. I really want to add a note before leaving for people who want to practice or who want to enter into PMU. I request them to have a good knowledge and good education before entering into the industry, because we cannot just simply jeopardize the practice or risking some other's look, because it's not just any canvas, it's someone's image. So a person should be very careful before starting any procedures in someone's face.
Thank you, doctor. And I hope this, like I said, this reaches a lot of people who might need to hear this today.
Thank you. Thank you so much for having me here. I really enjoyed the conversation.
Thank you.